Hello, my name is Dan Harper. I'd like to introduce myself and the team behind Eliza's Watch. They include Dr. Bill Soares, Dr. Dane Scantling, Liz Wynot, and Jeff Olmsted. We are also very fortunate to have Dr. Ruth Potee on the team in an advisory capacity. Everyone on the team is a hipster. We all come from different backgrounds and different experiences, but we share a focus and a compassion for the end user in their struggle. Our lead hipster is Dr. Bill Soares.
Now, in my job as Director of Harm Reduction Services, I work with patients every day after a non-fatal opioid overdose, helping them to avoid a future overdose by providing Suboxone, Narcan, and harm reduction resources. I met Dan many years ago through a meeting with community members. The story of his daughter Eliza is one that's all too familiar to me as an emergency physician. A patient with opioid use disorder on treatment and doing well, who with one relapse, dies. One relapse should not lead to death. The concept of Eliza's Watch, a wearable overdose alert system, is incredibly important.
Liz Wynot is the Director of Harm Reduction at Tapestry Health Systems. She works directly with people using drugs. She knows the pains and the challenges of people struggling with addiction, and she understands the cyclical nature of recovery. She directs multiple programs, all with a unified goal of reducing drug overdose. Dr. Dane Scantling is a trauma and acute care surgeon at Boston Medical Center and an associate professor at Boston University. He is researching and developing opioid minimizing surgical procedures. During his residency in Philadelphia, he was a champion for the safe consumption facilities movement. He always puts the needs of his patient first and gives them a voice at the table. Dr. Ruth Potee is a rock star in the harm reduction arena. She's not only a family physician, but she serves as medical director of 3 organizations and is committee co-chair of our regional opioid task force. Ruth is a powerful speaker and explains the addicted brain in a way that is compassionate and accessible to countless audiences. Jeff and I are the hackers of the team. Jeff knows how to orchestrate all the moving parts to get urgent critical care to our end user.
I've been a paramedic for 26 years, and during that time have seen our share of overdose-related injuries and deaths. We're hoping you can help us with this project, this harm reduction device. We believe it can be a valuable tool to buy us time to be able to get to people when they really need it.
I'm also the hustler of the group. Ever since I lost Eliza, I've been driven to build this tool. I partnered with a local nonprofit and we built the first version. It was a high-tech smartphone app that worked really well. But the data was less than reliable, and the price was making it inaccessible to the people that need it most. So I left that partnership, and with the support of my team, developed the current, simpler version that we are asking for your support with today. I raised 5 children. I understand the human condition. I am a programmer. I understand technology. I suffered a huge preventable loss. I understand tragedy. This is what drives me every day to build Eliza's Watch.
Now, in my role, apart from clinical work, I'm also an NIH-funded researcher with grants from NIDA evaluating the impact of opioid medications and treatment strategies for patients with opioid use disorder. While Dan has created the vision and technical expertise of Eliza's Watch, I have the experience, the infrastructure, and the resources to lead the research plan.
We are a diverse group of professionals with a deep understanding of the problem and a strong commitment to success. We have a go-forward strategy for both research and manufacturing, but we need the funding and welcome the mentorship to help us navigate successfully. Thank you very much for your time and your consideration.